Obsessive-compulsive disorder, OCD, is a mental health condition that is characterized by intrusive, unwanted thoughts and repetitive behaviors or mental acts that individuals feel compelled to perform in response to those thoughts. OCD affects people of all ages, genders, and backgrounds. The prevalence of OCD is estimated to be around 1 to 2% of the population. The onset of OCD typically occurs in adolescence or early adulthood. The exact cause of OCD is unknown, but it is thought to be due to a combination of genetic and environmental factors. Individuals with OCD experience persistent, unwanted, and intrusive thoughts, images, or impulses. These thoughts are often distressing and can lead to feelings of anxiety, shame, or guilt. Common obsessions include fears of contamination, harm to oneself or others, or a need for symmetry or order. Compulsions are repetitive behaviors or mental acts that are performed in response to these obsessions. Compulsions are aimed at reducing anxiety or preventing harm, but they are not realistically connected to the feared outcomes. Common compulsions include excessive cleaning, checking, or counting. Individuals with OCD often experience significant distress and impairment in daily functioning. The severity of OCD symptoms can vary widely, from mild to severe. Diagnosis of OCD is based on the presence of obsessions and/or compulsions that are time-consuming, distressing, and interfere with daily functioning. OCD is often comorbid with other mental health conditions, such as depression, anxiety, or eating disorders. Cognitive behavioral therapy, CBT, is a first-line treatment for OCD. CBT for OCD often involves exposure and response prevention, ERP, a specialized form of therapy that gradually exposes individuals to feared situations or thoughts while preventing them from engaging in compulsive behaviors. Medications such as selective serotonin reuptake inhibitors, SSRIs, may also be used to treat OCD. Deep brain stimulation, DBS, is a surgical treatment that is sometimes used for severe, treatment-resistant OCD. OCD is a chronic condition, but symptoms can be effectively managed with appropriate treatment. Self-help strategies, such as mindfulness, exercise, and stress management, can also be helpful in managing OCD symptoms. It is important for family and friends to provide support and understanding to individuals with OCD. Treatment for OCD may take time, and relapses are common, but recovery is possible. The stigma associated with mental illness can make it difficult for individuals with OCD to seek help. Educating oneself about OCD can help reduce stigma and increase understanding. Individuals with OCD may experience a range of physical symptoms, such as headaches, nausea, or muscle tension. OCD can impact relationships, work, and daily activities. Avoidance of feared situations or thoughts can lead to social isolation and decreased quality of life. Children and adolescents with OCD may experience difficulty in school, socializing, and completing homework. Early intervention and treatment for OCD in children can help prevent long-term impairment. Substance abuse is common in individuals with OCD, as they may use drugs or alcohol to cope with distressing symptoms. Family members may also experience distress and may benefit from therapy or support groups. Exposure and response prevention, ERP, is the most effective form of therapy for OCD, but it can be challenging and uncomfortable for individuals to undergo. Cognitive restructuring, a component of CBT, can help individuals challenge and modify negative thoughts related to OCD. Mindfulness-based approaches, such as mindfulness-based cognitive therapy, support groups and peer support can provide individuals with OCD a sense of community and understanding. Family therapy can be helpful in improving communication and reducing family conflict related to OCD. The severity of OCD symptoms can fluctuate over time and may be influenced by stress or life events. Avoiding triggers or stressful situations can temporarily reduce symptoms, but can also reinforce OCD behavior. Mindfulness practices, such as meditation or deep breathing, can help individuals with OCD manage anxiety and reduce compulsions. Graded exposure therapy involves gradually exposing individuals to feared situations or thoughts, starting with less distressing scenarios and gradually building up to more challenging ones. Virtual reality therapy has shown promise in the treatment of OCD by simulating feared situations in a controlled environment. The Yale-Brown Obsessive-Compulsive Scale, YBOX, is a commonly used tool for assessing the severity of OCD symptoms. Co-occurring mental health conditions, such as anxiety or depression, can complicate treatment of OCD and may require a tailored treatment plan. In severe cases of OCD, hospitalization may be necessary to ensure the individual's safety and provide intensive treatment. Continuing therapy and medication management can help individuals with OCD maintain symptom control and prevent relapse. In conclusion, OCD is a complex and often debilitating mental health condition that requires appropriate diagnosis and treatment. Effective treatments, such as cognitive behavioral therapy and medication, can help individuals with OCD manage their symptoms and improve their quality of life. However, OCD can be a chronic condition, and ongoing support and management may be necessary to maintain symptom control. Education and support for individuals with OCD and their families can help reduce stigma and improve understanding of this challenging disorder.